Welcome back to my channel. So today's topic is vitiligo. So let me give you some details about this condition where the skin becomes white in various regions. So let me give you some details about this, what exactly it is, what might be the reason for this, and what are the various diagnostic methods by which you can understand this vitiligo and few treatment options. So as I told you, vitiligo, it is the white coloration of the skin. So basically our skin, this is the normal skin, just to show you the morphology of it. So you can see the skin has got these layers, and in the skin we have a particular pigment called as melanin. So this is the pigment which gives brown color to our skin, and lack of this pigment somehow by some destruction mechanism of the melanocytes which are present in the skin can lead to this problem of vitiligo. So once we do not have these cells which are producing melanin, the skin becomes white. So this is what is shown in the picture here, and this is how it looks once a person is having this issue with vitiligo. So the regions or parts of the skin which are mostly affected is face, neck, hands. And the people who are having this issue with vitiligo, they are more vulnerable to sunburns. So that's why they need to use a lot of sunscreens, and this can affect even your scalp region, and your premature graying of hair can happen because of this. And these patches which are seen can occasionally be even itchy. So coming to the types of vitiligo, we have segmental vitiligo and non-segmental vitiligo. So non-segmental, the name tells you that in this case the vitiligo can happen in any parts of the body, like it won't be segmented to one side of the body, it will be throughout the body. So this is an example of the hand here to show you non-segmental vitiligo. But you can see this image below, which is the segmental type, where you can see one part of the face is having this issue. So this can be different types, and in the rare condition you might see a complete body turning into vitiligo. So here basically the patches can happen in various parts like your hands, arms, skin, knees, elbows, feet. So these are the regions which are most prone to this because they are most exposed part of the body. And when it comes to non-segmental vitiligo, at least out of 10 people who are suffering from this, 9 of them will come under this category. And segmental vitiligo is seen in children's. So what basically causes vitiligo? As I told you, it is the problem with the pigment, that is melanin, and this pigment is produced by a cell called as melanocytes. So this is to show you the melanocytes which are present in our skin surface, and these melanocytes are the ones which are producing this brown color pigment, and that pigment is deposited on the surface of the skin, which makes it brown color. So now if by some mechanism these cells are destructed or destroyed, then these cells are not there to produce this pigment, and if this pigment is not produced, we do not have a brown coloration in the skin, which leads to white patches. So here this can be an autoimmune disease also, so where your body by some mechanism feels that these melanocytes are foreign cells, and it starts attacking these melanocytes and destroys these melanocytes. So once this happens, the cells are destroyed and the melanin pigmentation is not seen, which can lead to vitiligo. So this is to show you that where the CD8 cells, the T cells of the body, are recognizing these melanocytes as foreign molecules and going and attacking it. So now these cells are destroyed, and once these cells are destroyed, it cannot produce the pigment. So this is again to show you various reasons for this. So this mechanism of autoimmune disorder can happen because of a lot of environmental factors. So if it might be because of continuous working in some occupation, and there you are continuously getting exposed to some chemical which leads to a lot of stress. Okay, so these melanocytes will undergo a lot of stress there, and these melanocyte signals, okay, the stress signals will be in the body. And once these stress signals are given inside the body, the immune system that we have, it becomes very active, and it feels that these melanocytes are foreign molecules. It will go and attack it. So we have our T cells which does that. So these T cells and other things will go and attack this melanocytes and destroy it. So in this way, this is a self-destruction mechanism which is usually seen in autoimmune diseases. So coming to the risk factors, it can run through families. So any member of the family, if they have it, this kind of autoimmune conditions can happen to them. And in case you're suffering from some kind of skin diseases, then the chances of this is more. And very skin related issues, if you have too much like skin damage, sunburns, that also can lead to these issues, because it will have an impact on the melanocytes, and if melanocytes are destroyed, this issue can start. So I told you about occupational thing. So here basically if you are getting exposed to certain chemicals during your work time, okay, so these chemicals, you are going to have these chemicals maybe for 10, 20, 30 years, you are having these chemicals in the system, and you're trying to, the cells are taking these chemicals. On the long run, this can have a negative impact on the cells, and that can lead to this problem of vitiligo. So there can be a lot of chemical signals and environmental triggers which can have a negative impact on these melanocytes, which can lead to issues. But you cannot spread it from one person to another. So if one person has this issue of vitiligo, you should not have a thing that the next person sitting next to him also will get this issue from the first person. So this cannot happen. So this is something to do with yourself, and you cannot spread it to the next person. So you can, in the families it runs because they might have the genes in such a way that their cells are not very strong enough, or any other environmental triggers there can lead to those issues. So coming to symptoms, I already spoke about the various parts which are usually affected, the exposed parts, and it also leads to sometimes the premature graying of the hair. So not only in the head region, even your scalp, your eyelashes, eyebrows, beard, everything will turn gray prematurely. So it leads to a lot of issues to people. So this is why this topic is considered. And when you should see a doctor, basically if you see that your skin is getting white patches, so certain times if you have certain vitamin deficiency also, you can have small white patches. So these are something different. So this keeps on spreading and it becomes bigger and bigger in size. So that is one indication that you might be having this issue. So it's better to go and check with the doctor. So there is no complete cure for this particular problem. So that is one thing that is you need to understand, but you can make this process slow. Okay, so the process of whitening of the skin can be made in a slower rate, and even you can see to it that you can return some skin color to your body. So those kind of treatments are available. So this can lead to a lot of psychological distress, and there are a lot of people who go into depression because of this issue that they are facing. Even one more complication is a lot of sunburn, which can lead to further destroying of melanocytes, which can lead to more vitiligo condition again. And they are also prone to a lot of eye problems and hearing loss also. So coming to the diagnostic approaches, most of the time skin biopsy will be done. So these are just to show you different methods of biopsy which can be done, like shave biopsy, punch biopsy, or excisional biopsy. So these kind of biopsies can be done, and finally the skin tissue can be taken and it can be further analyzed to see if the melanocytes are damaged, and that might be the reason for vitiligo. Even blood tests can be done where you try to find out the reason for autoimmune disease, and a complete blood count can be done to get more details on that. Apart from that, there is something called as ANA test. So this is anti-nuclear antibody test. So this will give you an indication that the person is suffering from autoimmune disease. That is, the anti-nuclear antibodies usually attack your own tissues. So if this test result tells that you have a lot of ANA antibodies, it is the indication that you might be suffering from autoimmune disorders. Apart from that, even doctors might use a UV lamp to inspect the area very well so that they can understand if this is a vitiligo condition. So this is one place where you get some solution or some kind of benefits. So Kayakalp Global. So this is the first Indian vitiligo specialist center. So Dr. Dhawan is in this, the main person who is involved here in this treatment. So they have treated more than 50,000 patients worldwide, not only with vitiligo, but even other problems like psoriasis and things like that. So this is their WhatsApp number, and you can just put a a picture of your affected area in the WhatsApp, and they will personally contact you back to give you advice. And even if you want to take the medicines from them for the curing of it, or not curing, especially basically to reduce the brown patches, basically the whitening of the patches, and to make it at a slower rate if that is required, then even the cash on delivery facilities are available. So this is just to show you few results of them. So this was the before and after kind of photographs, where you can see a lot of brown coloration is there after treatment, and the slowing of the rate of this white patches has been seen here. So coming to the takeaway messages, we have seen that once we develop this kind of conditions, that is vitiligo, it's most of the time it can be a long lasting situation, but there are few treatments which can help you in decreasing this rate at which this whitening happens. And even some solutions or some creams will be given which will help in giving some brown coloration to the skin. So you cannot spread it from one person to the other. So that is one more important thing. And certain times they give corticosteroid creams which might be helpful, and sunscreen, use of sunscreen can be of good help. So stay vigilant, stay safe. So if you have not yet subscribed to my channel, please do subscribe to my channel, and please share this video with maximum people, so that if anybody has some issue with vitiligo, this video might be some help to them. Thank you.